Oh, there we go. Good morning, everyone. Welcome to the State Federal Grants Office Hours. As always, I like to give 3 minutes for our latecomers, so give us until 10:33 and we'll get started. If you're attending this training, it's because you have ESG, probably had ESG-CV, and you're interested in HOME-ARP. So you need to know how these programs overlap and how to make sure you don't get in trouble between the programs. We will get started at 10:33.
I know it's cold, isn't it? All right, so
are we on here?
So you can read this letter. They gave us this $1,500. This is what they were talking about before. You know, when they were talking about it, y'all's training. They
Yeah.
give
I don't think.
Hmm?
I need to go do my man on my bed for my next. I just got to, it's an unbelievable believe. And she not take me. Do I need a friend for that? If you ain't got to plug out.
Good morning, Mr. Fred.
Hey, good morning, man. How you doing?
I'm good.
Good. How's everybody doing, rather?
I get tickled every time I see you, because I think about that time you tricked us all into saying touch your nose or touch your cheek there at that meeting, and you got 100 people that put their finger up to their.
Yes, sir. Yes, sir. Yeah, we hope everything's been going well with you and all of the rest of the ones that are on the line too as well.
Thank you.
Yes, sir.
It is 10:30. Good morning. I am sorry, y'all. I have a little frog in my throat, but can someone confirm that you can hear me well and see me?
Yes, we can hear you and see you.
I see. I ain't hearing none.
Y'all, I could hear everybody until just now. Fred, it stopped working again.
Oh, no, we can hear you.
I can't hear you. So what I'm going to do, I'm going to continue my presentation here. And if you don't mind manning the questions, just as before, our office hours is 1 hour, 10:30 to 11:30. The first about 15 minutes of our office hours, we're going to provide you with information and content. The information today is going to be intense, a lot of information, but this is just one of many series regarding HOME-ARP and the overlap of programs. The last 30 minutes of our office hours will be for questions and answers. Warning, I cannot hear anyone. I'm going to present, and right before we get into questions and answers, I'm going to go over to my neighbor's office and borrow his computer so I can hear what's going on. Okay, so if you try to stop me, contact me, or anything whilst I'm presenting, I will not hear you. Just wait until after the presentation and we will be able to answer questions, okay? And sorry, my computers work for some reason, but once the, I guess, meeting get to like 10 people, it goes away. I can't hear no one anymore. I don't know what's going on there. All right, let me share my screen. Okay, same but different. ESG, ESG-CV, and HOME-ARP. Today we'll go over program definitions, which you already know, overlapping areas, the differences, and then how these programs connect. All right, so ESG, this is our foundation. This is where it first started. This is where everybody is used to. Now we have HOME-ARP, and we also had ESG-CV during COVID. Things where you will see a lot of the overlaps is going to be the applicant. In all three programs, the applicant is the same, and we'll talk more about that in detail. Supportive services going to be the same in all three programs. Shelter operations, strictly for ESG and ESG-CV. Development of rental units and non-congregate shelter is strictly HOME-ARP. COVID activities with strictly ESG-CV, and it's not allowed in HOME-ARP or in annual ESG. So back in our high school days, we all know the Venn diagram. There's a lot of overlap in these programs, but there are specific areas where these programs do not overlap and cannot overlap. Also, the waivers. The waivers was very helpful during COVID with ESG-CV. Unfortunately, HUD did not transfer the waivers over to the HOME-ARP program. I know there's a lot of concerns about FMR. We are requesting a specific waiver, but none of the ESG-CV waivers are allowable in HOME-ARP, and they are not allowable in ESG. Those waivers have expired and cannot be applied. ESG. As we know, the ESG program provides funding to engage homeless individuals and families living on the street or in shelter or other places not meant for human habitation. It also provides essential services to residents in a shelter or receiving shelter services. It rapidly rehouses homeless individuals and families, and it also prevents families and individuals from becoming homeless. The ESG funds may be used for 5 program components, which includes street outreach, emergency shelter, homeless prevention, rapid rehousing, and HMIS, as well as admin activities, which is usually governed by Mississippi Home Corporation. ESG funds are provided annually and are managed by the state. ESG-CV. The CARES Act appropriated $4 billion to the Emergency Solutions Grant program to prevent, prepare for, respond to COVID for those who are homeless or about to experience homelessness. In response to prevent, prepare for, and respond to COVID, what we did was we included that language in our CON plan and in our annual action plan and in our policies. So it's nothing specific the agency had to do except for serve those, but by serving those, you did prevent, prepare for, and respond to COVID. ESG-CV program used ESG regulations, the 24 CFR 576 regulations that we are all familiar with, but it added mega waivers. So we had specific ESG-CV waivers, and then we had what was called mega waivers for the ESG program that was allowed during the COVID pandemic. ESG-CV was a one-time funding program with expenditure deadline of 9/30. With the end of ESG-CV funds, the waivers went away and they're no longer allowed. HOME-ARP. HOME-ARP is not funded through the COVID funding, but instead is funded through the American Rescue Plan. $5 billion was set aside. The state of Mississippi received, the state of Mississippi received $35 million to assist individual households who meet the qualified population as homeless, at risk of homelessness, and other vulnerable populations, including domestic violence, veterans, and youth. It provides housing, rental assistance, supportive services, non-congregate shelter to reduce homelessness. It also allows for increasing housing capacity by rental development. Eligible activities under HOME-ARP includes production or preservation of affordable housing, that's development of rental housing, tenant-based rental assistance, supportive services, which includes the services identified under homeless prevention and housing counseling, purchase and development of non-congregate shelter. HOME-ARP is a one-time funding program with an expenditure deadline of September 30th, 2030. We're going to first go over the overlapping areas, and I hope you can see this, but if you can't, the presentation will be made available to you. So at the top, you can see by the columns, we have ESG, ESG-CV, and HOME-ARP. And then by the rows, we have the eligible applicants straight down. So all of these areas will be talking about eligible applicant. So for ESG, the eligible applicant, along with ESG-CV, was homeless, which we define as literally homeless, imminent risk of homelessness, or fleeing and attempting to flee domestic violence. Under HOME-ARP, qualifying population QP number 1 is homeless, literally homeless, imminent risk of homelessness, and fleeing an attempt to flee domestic violence. So the population for category 1 is the same. For ESG, category 2 population at risk of homelessness is defined as 30% AMI and unstably housed, meaning the at risk of homeless definition. Specifically for the state, we look at category 1. For ESG-CV, it was 50% AMI, unstably housed, and meeting the at risk of homeless definition, specifically looking at category 1. For HOME-ARP, the at risk of homeless definition does not go to the waiver of 50%, it goes back to 30%. So category 2 for HOME-ARP, at risk of homeless definition is 30% AMI, unstably housed, and meet the at risk of homeless definition category 1. These areas are where they overlap. HOME-ARP has 3 additional eligible categories to receive services. Qualifying population, category 3, domestic violence, sexual assault, and trafficking, based on the definition described in 24 CFR 5.2003, or the Trafficking Victim Protection Act of 2000. Qualifying population, category number 4, other populations. This is where the 50% AMI that we use for ESG-CV comes into play. If you have 50% AMI and meet the conditions of at risk of homelessness definition, you will qualify for HOME-ARP. So now, QP4 for HOME-ARP actually takes into account the ESG-CV category. Finally, QP5, qualifying population number 5, veterans. To qualify as a veteran for HOME-ARP, you have to meet category number 1, or category number 2, or category number 3, and be a veteran. There's no just veterans as a qualifying eligibility category. You have to be a veteran and be homeless or at risk of homelessness or fleeing, attempting to flee domestic violence. Overlapping areas. So we saw that the populations overlap, right? If you go, let me go back real quick. The individuals that are eligible for ESG or eligible for ESG-CV, they both are eligible for HOME-ARP. There are some areas of overlapping in regards to services and funding category. Under ESG, we do provide street outreaches eligible under ESG and ESG-CV. ESG funds can be used for street outreach, which include engaging individuals experiencing unsheltered homelessness. So this is reaching out to those who are sleeping outside in abandoned buildings, on the streets, in the park, or in their car, and providing them with services to help them move into a shelter or be safe and secure, including case management, emergency health outpatient, mental health services, transportation, and other things related to the engagement of homeless individuals who are unsheltered. ESG-CV allows for the same activities for street outreach, but it also added some COVID-related items, which includes hand washing station, hazard pay, volunteer incentives, and COVID-related training. Those COVID activities that were allowed with CV are no longer allowed. So you cannot pay for hand washing station, hazard pay, volunteer incentives, or COVID training. HOME-ARP does not do street outreach, but HOME-ARP does do outreach, which is allowable category under supported services. Outreach can cover the cost for staffing, including salary, travel, and cell phones and equipment needed to do outreach, to help them or direct services such as a crisis management line, referral system, food costs, blankets, hygiene kits. So the cost that you would have charged to street outreach plus the cost you probably would have charged to manage a crisis line are eligible under outreach for supported services for HOME-ARP. Shelter. Shelter is an ESG funded component. Under ESG, we can pay for operations and essential services. We'll talk more about essential services in the next slide. Under ESG-CV, shelter paid for operations, essential services, and COVID-related activities, including hazard pay, hand wash, volunteer incentives, hotel and motel cleanup. Those activities are no longer allowable. Shelter under HOME-ARP is not allowed, but the essential services are allowed under supported services. So let's talk about shelter essential services. This is a category that sometimes agencies are hesitant to tap into, but it is allowable in all three of these funding areas, or all three of these funding grants. Under ESG, essential services related to shelter only. So under ESG, essential services related to shelter only. So if you want to do essential services, you must be providing shelter services. And they include case management, child care connected to a shelter. This is not for child care vouchers, but child care connected to a shelter, education services, employment assistance and job training, outpatient health services, legal services, life skills training, mental health services, substance abuse treatment as outpatient. Under shelter, we also can pay for food through shelter operations. For ESG-CV, essential services were allowed under shelter, and with a waiver, we were able to provide essential services through rapid rehousing and homeless prevention. Therefore, someone who is not in the shelters could still access employment training, education training, legal services, life skills, outpatient health services. They are not allowed under annual ESG for rapid rehousing and homeless prevention. They're only allowed under shelter. HOME-ARP, under supported services, you can provide those same essential services. which are case management, education services, employment assistance, job training, outpatient health services, legal services, life skills training, mental health services, substance abuse training, and food. Because these essential services falls under HOME-ARP supported services, all qualifying populations as homeless, at-risk, domestic violence, veterans, youth, all qualifying populations will qualify for support services. That's the biggest difference. Annual ESG does not allow for essential services in rapid rehousing and homeless prevention. HOME-ARP does allow for essential services under supported services for all qualifying populations, including homeless, at-risk, domestic violence, veterans, and youth. Let's continue with essential services for shelter. Sorry, that should be services for rapid rehousing. So housing stability services for rapid rehousing and homeless prevention. These are where they are overlap. Please excuse this typo. This should say rapid rehousing, okay, and homeless prevention. Housing services. ESG housing stability services for rapid rehousing and homeless prevention can pay for rental application fees, security deposit, moving costs, utility rental deposit, rental utility arrears at 6 months or less, short-term rental assistance, medium-term rental assistance as defined by the time. So short-term is 0 to 3 months, medium-term is 4 to 24 months. First and last month's rent, tenant-based rental assistance based on short-term, medium-term length of time, housing stability case management, housing search and placement, mediation, legal services, and credit repair, which is credit counseling. Under ESG-CV, you are allowed to pay for rental application fees, security deposit, all the same things until we got to landlord incentives and essential services, which is job training and job placement. These two activities, landlord incentives and essential services, are no longer available. They're not allowed in ESG. HOME-ARP. HOME-ARP pays for the exact same things: rental application fees, security deposit, moving costs, utility rental deposit, utility and rent arrears for 6 months. Short-term assistance, 0 to 3 months, medium-term assistance, 4 to 6 months. That's the difference. HOME-ARP can go to 24 months, but the state will limit rental assistance for HOME-ARP to 6 months. And I'll explain why later. First and last month's rent, housing stability case management, housing search and placement, credit counseling. Additional area available is housing counseling. Housing counseling is unique to HOME-ARP. All right, let's look at areas where they differ. Fair market rent versus rent reasonableness. ESG, you must meet rent reasonableness and not exceed the FMR. The ESG-CV, you must meet rent reasonableness, but the FMR was waived. Unfortunately, with HOME-ARP, the FMR is not waived, so you must meet rent reasonableness and not exceed FMR. Emergency shelter and street outreach budget caps. Annual ESG, we have a max of 60% of the budget for emergency shelter and street outreach. So sometimes I will deny a budget modification to put more funds in shelter. It's because we reached our cap for the state for how much funds can be used in shelter. ESG-CV, there is no cap, and HOME-ARP doesn't pay for emergency shelter, so it doesn't apply. Match requirements. ESG does require 100% cash or in-kind match. ESG-CV, no match requirements. HOME-ARP, no match requirements. Areas that they differ continues. At risk of homelessness, income eligibility. ESG, you have to be at or below 30% AMI. HOME-ARP, at or below 30% AMI. And ESG-CV, at or below 50% AMI. Reevaluations. For ESG, homeless prevention must be reevaluated for eligibility every 3 months, rapid rehousing once a year. ESG-CV, homeless prevention reevaluation is every 6 months, and rapid rehousing once a year. HOME-ARP does not have a schedule for reevaluation. The state will implement a schedule as fit for TBRA assistance. Other populations, HOME-ARP allows for 50% AMI and homeless prevention definition. Frequency of case management for rapid rehousing and at risk of homelessness. For ESG, homeless prevention, rapid rehousing, those individuals who qualify, requires to meet with their case manager not less than 1 time a month. So at least monthly at ESG, you must be meeting with your case manager. That could be virtually or in person, but there needs to be a note that a meeting happened once a month with ESG. ESG-CV waived that once a month requirement, but we did still require meetings as often as possible. HOME-ARP, the state recommends monthly, but there's no federal regulations on that. Length of time of housing stability case management for at risk of homelessness or homeless prevention or homeless and rapid rehousing, that's 30 days. For ESG-CV, it cannot exceed 60 days. The state recommends for HOME-ARP 30 days, okay? Now the housing stability case management, that's before you move that person into housing. That's the housing search and placement. HUD ESG regulation requires you to move someone who is in rapid rehousing, should be placed in housing and moved in within 30 days. Do not place someone in your rapid rehousing program who's not ready to move in, because we're looking for that person to be housed within 30 days. Unit inspection. ESG requires housing stability only. ESG-CV allows for housing stability, housing standard or HQS, and HOME-ARP as of 10/1/24 will be using the Inspire. Actually, as of 10/1/24, ESG and HOME-ARP will both be using the Inspire training. Inspection for units and shelters. Housing stability plan is required for ESG. It was required for ESG-CV, and it will be required for HOME-ARP. Hotel motel room costs. This is allowable expense under ESG for shelter. ESG-CV, it was allowable for persons who was in shelter or rapid rehousing or COC programs if they had to go to a hotel to quarantine due to COVID. HOME-ARP, hotel motel costs is not allowed. Procurement. Under ESG, we use local procurement standards apply. The states use the federal standards. You might have your own internal procurement policies. ESG-CV, there was alternate waivers for procurement. For HOME-ARP, we will use the local and state procurement standards. Disqualification as category 1 due to institutional setting. As you know, the homeless definition category 1, if you are in institutional setting for longer than 90 days, you don't qualify as homeless anymore. You have to be homeless and go into an institutional setting and discharge before 90 days to keep your homeless label. I don't want to say label, but to keep your homeless definition. ESG still requires that standard. ESG-CV allows for someone to stay in an institutional setting for 120 days and keep that homeless designation. HOME-ARP does not have any preference on that. If you don't qualify under homeless, you will qualify under at-risk or under other population. Transportation. Transportation is allowable under ESG for street outreach, shelter, rapid housing, and homeless prevention. It's also allowable under ESG-CV for all those categories, and it's allowable under HOME-ARP under supportive services. Ineligible ESG and HOME-ARP expense. So these are costs that were eligible under ESG-CV, but are not eligible under ESG or HOME-ARP. Hazard pay, vaccine incentives, volunteer incentives, landlord incentives, temporary emergency shelter. Now, the temporary emergency shelter is when some communities were renting or reserving a block of rooms in a hotel at one time. That's no longer allowed. Rental insurance not allowed. Household furniture for homeless prevention and rapid rehousing is not allowed under annual ESG or under HOME-ARP. COVID-related activities not allowed. Infectious disease training for staff, placing a participant in a hotel for COVID recovery, it's not allowed. Laundry services not allowed anymore, and cell phones loan or purchase for applicants not allowed. You can continue to purchase cell phones for your staff that does these activities, but you cannot loan or purchase cell phones for applicants. Ineligible activities continue. Sponsored base rental assistance, shower trucks, essential services for homeless prevention and rapid rehousing, HMIS lead costs for non-HMIS lead agencies. And we didn't use that one though. Cleaning and damage repair for hotel motels, not allowed anymore. Project-based rental assistance, payment for rent for up to 30 days for a vacant unit. Now, a lot of y'all probably don't use rental assistance as project-based or tenant-based rental assistance. However, it is allowable. What ESG allows is for participants or subrecipients may pay up to 100% of the first month's rent once the person moves in before the end of that month. With COVID, we could pay all the way up to the 30 days, but the traditional regulations is the person must move in before the end of the month if you're holding or trying to obtain units in advance. As I mentioned before, landlord incentive hazard pay is not allowed. Temporary emergency shelter block of rooms not allowed. Ineligible costs for HOME-ARP only. These are costs that are allowable under ESG, but not allowed under HOME-ARP. Hotel, motel, shelter operations, HMIS or any database costs, traditional shelter, rehab or renovation. So I said traditional shelter, rehab or renovation is not allowed. Traditional shelter maintenance is not allowed. Direct payment to applicants are not, these are costs that are not allowed for ESG, ESG-CV or HOME-ARP. Direct payment to applicants, duplication of benefits, payment to creditors, mortgages or mortgage payments, including mortgage payments on a shelter, that's not allowed. any cost that results in conflict of interest. So if that's paying rent to a landlord that may be related to someone in your staff or related to the applicant, or is that it might be providing job training and your job trainer is related to someone on your staff. That's still a conflict of interest. Transitional housing is not allowable in HOME-ARP or ESG or ESG-CV. Transitional shelter construction is not allowed. Purchase of a building for traditional shelter. Any cost that will be considered reasonable and that will not be considered reasonable and appropriate. And I want to take a minute to talk about reasonable and appropriate. During one of our state office hours with HUD, they gave us an example of reasonable and appropriate, or not being reasonable and appropriate. The example was a case manager working with a client was proud that the client did so much in accomplishing their goals. So to congratulate the client, the case manager decided to take the client to Applebee's and purchase the client's meal and charge that to the grant. It was a great gesture, but it's not reasonable and it's not appropriate and cannot be charged to the grant. Unique to HOME-ARP, tenant-based rental assistance. Tenant-based rental assistance is allowed under ESG, but only under short-term and medium-term rental assistance. The tenant-based rental assistance under HOME-ARP can last until 2030, the end of the program year. Housing counseling is unique to HOME-ARP, is not allowed under ESG, and it is allowable expense under support services for HOME-ARP. Rental construction and non-congregate shelter construction are both new categories that are unique to HOME-ARP. Let's spend a few minutes talking about how these programs can connect, connecting ESG and HOME-ARP. Shelter, non-congregate shelter. Okay, so if we have shelter, if you have a shelter, you may want to use HOME-ARP to build or convert your shelter into a non-congregate shelter. ESG can also be used to pay for that non-congregate shelter operations. So HOME-ARP can build a non-congregate shelter. ESG can pay for the non-congregate shelter operations. Or you can work with your COC and transition a non-congregate shelter that you developed to a permanent support housing unit and increase the housing capacity in your community. Rental development. ESG can pay for deposit and housing and case management, housing case management services for applicants. You can then transfer that client to a TBRA voucher if they need more assistance. This will give them a longer length of time of rental assistance if you see it's needed. HOME-ARP can also provide support services to increase self-sustainability. So whilst they're in program, you might get them into education, employment training, or different type of programs. And after all of that, you can discharge them to affordable housing because you're working with rental development to place them into those units set aside for this population. Rental assistance. You might not want to transfer a client into one of the units that were developed through HOME-ARP. You might want to use a private landlord, maybe because the unit is not available as yet. A client then can move from ESG shelter. ESG can move them in with deposits and moving costs, and then they can probably go into a HOME-ARP TBRA voucher and receive supportive services to increase self-sustainability through HOME-ARP. These are just examples of how the programs can work together and not stand alone. Rental assistance, tenant-based rental assistance. So your qualifying population automatically can receive tenant-based rental assistance. HOME-ARP TBRA can be provided to those who we think it can be the best fit. HOME-ARP support services can then be used to those who have a TBRA voucher to increase their self-sustainability. I mentioned previously that for supportive services, HOME-ARP can pay for 3 months to 6 months rental assistance. That's different than TBRA. So you can use HOME-ARP to pay just for rental assistance. And if you see that client may be better fit for TBRA, you can move them over to TBRA. And this is why we capped rental assistance to 6 months, because you can still activate a TBRA voucher instead of paying 24 months on rental assistance and the supportive services. We would like to see supportive services used more to improve self-sustainability, improving skills, increasing income, case management, budgeting, things that are life skills, things that are needed to sustain housing that a client probably won't have access to in other programs. As we work with the programs, you have to be careful of duplication of services. These programs are or developed to work together, but you have to make sure that those lines don't overlap. Financial assistance cannot be provided to a program participant who's receiving the same type of assistance through public services. This may mean that if they're on Section 8, you can't give them a TBRA voucher. If they're receiving rental assistance from ESG and you pay rent for July, TBRA can't come in and pay rent for July. You need to transfer them into a different program and make sure that they were discharged of one program before they enter into another program, so the assistance will not be provided at the same time. Our conference this year, we will be having HOME-ARP specific sessions. If you attended our conference last year, we had a lot of information about the development of the HOME-ARP program. You got a lot of content. There was a joke going around that we will have a speed dating session because we want our support services agencies to meet our developers, because you have to work together. We are going to have that session. It's called HOME-ARP Speed Networking. If you're serious about applying for HOME-ARP and being considered for HOME-ARP funding, you may want to consider going to our conference this year. We will have our HOME-ARP Speed Networking session. We will also have a session called Connecting the Dots HOME-ARP. This is so you can see how the transition needs to happen from rental development to support services to TBRA and non-congregate shelter. We will also have HOME-ARP one-on-one sessions for development. So if you're looking at partnering with a developer for non-congregate shelter or rental development, we will have one-on-one sessions at the conference for that. Our office hours next month will be a little different. We will allow for one-on-one sessions for agencies who are applying for the HOME-ARP application, which is due April 1st. We will allow for one-on-one sessions to go over your applications, okay? Now, going over your application doesn't mean that you will guarantee that you will get funded. Honestly, the person reviewing your application on the one-on-one session probably will be me. I'm not going to be the person ranking your application. We're going to let that be done by someone that's not directly connected to the agencies. But that's what we'll be doing next month. Okay, so we're going to move into the question and answers. Give me about 1 minute to move to the next room so I can hear the questions, and we will start.
Of course, no could be emailed in. Steve had one.
All right, sorry about that, Joe. My computer was working this morning. I tested twice, and now it's not working, but I can hear you all now. So let's see the questions that we may have coming up, and then we'll take questions on the mic.
Here's my email out, and then Steve had one.
Okay, are you able to see the PowerPoint? I hope you all saw the PowerPoint because you're finished with the PowerPoint. Okay, let me go on. Okay, it's recording. I think I see it's March 31st application. Okay, so for non-congregate shelter, the application for non-congregate shelter will be out in May. Kimberly Stamps and Lisa Coleman will be managing that application. The dates will be released probably the beginning of May, but it will be sometime in May. The application that's due April 1st is for supportive services and tenant-based rental assistance only. Okay, I'll take questions from the mic.
Hi, Tamara.
Okay, Dr. Whitman, yes.
Hi, yeah, so thank you for this. This was really concise and helpful, especially on top of the application workshop last month. Here's a question. I have several, but this is the main one. If we as a COC, bring together our partners and try to come up with a coordinated plan for our partners applying for these funds, would it make sense? So I'm understanding the qualifying population is large. What I'm thinking is if, we've got a victim service provider in our COC that generally will handle all of the either homeless or prevention of homelessness assistance for that population. If we were to write our applications in such a way, could we continue to do that through referrals, or is every agency that would receive HOME-ARP funds be expected to serve all members of the QP?
Right now, all members of the QB will be expected to be served. However, the question that came up for us for HUD is if all of the population are served, but through different funnels, would that be allowed? Because we are not skipping a population. Everyone will still be served, but DV agencies will focus on their DV, homeless will focus on their homeless, because we have so much agencies doing the work. It will look something like what y'all do now, the No Wrong Doors coordinated entry system. And that's what we have right now pending in HUD QQA or whatever you call it, for a response. So I have to come back to you with that, Dr. Whitman.
Okay, thank you.
But we are looking for it to look like everyone have access, but that access point will be different agencies, something like the No Wrong Door process.
That's perfect. Okay, and do we know?
That's what we're working towards.
Okay, do we know any more than what you discussed last month about how we're going to handle waiting lists?
No, we had several meetings, but nothing has been cleaned up. We will have it cleaned up by April 1st.
Okay, perfect. Thank you.
You're welcome. What I do know is that if we want to use HMIS, it won't be allowable expense under HOME-ARP. It'll have to come in a different form.
That's what I saw in this presentation. So that's helpful to know and to plan for.
Yes.
Thank you.
What I'm assuming is we'll probably get more contact from HUD that says database allowed general and not a name. And that's what I'm waiting to come out. We have a training actually with HUD today at 2:30. So some of the questions you're asking, it is about the wait list. We will be able to ask them then. All right, any questions, other questions?
I have a quick question about the funding that you mentioned at the beginning. With funding, what you apply for, are you getting that amount every year, or is that over the course of the year that we will be receiving the funds for this project?
So the ESG program funds comes out every year, it's competitive every year. The HOME-ARP funds, we will have a one-time application for HOME-ARP supportive services in TBRA. We'll have a one-time application. If you meet the requirements at the end of the year, that's expenditure requirements, spending up to 60% of your awarded amount, you will automatically receive a new contract year 2 going into year 30. Every year you'll get new money. You don't have to apply again. But if you do not meet your expenditure requirement of 60% each year, you will not be considered the next year. And you will stop and probably deobligate your funds and give it to an agency that can meet those spending goals. Does that answer your question?
Yes, thank you so much.
Okay, you're welcome. Any other questions?
Tamara, this is Sandy. I didn't hear, or can you send us out the PowerPoint? I think those little charts are very helpful.
I will definitely send you all those PowerPoints, especially those who had ESG-CV and now working with ESG. I want to make sure y'all get that right. The PowerPoint will be out this afternoon.
Thank you.
Any other questions? All right, don't forget, next month office hours will be one-on-one time for y'all to get your applications reviewed. Dr. Whip and I should have some clarity about the office wait list after our meeting with her this afternoon, if not by next month. If you have any other questions that you didn't think of during our training time, feel free to shoot me an email. Latoya, is she on the line? I know she had a meeting, but Latoya will be one of your main contacts for the HOME-ARP grant. As y'all know, Fred, our compliance officer, but y'all, he gonna make sure y'all get things right. We have Ms. Thea, Ms. Vicky working with the ESG. We do not have someone assigned to ESG-CV, so it's gonna go to one of us anyway. And we have Choice, and for Choice and HOPWA, we have Sharonda. But if you have any other questions that just may hit you, we don't mind sending in an AHU to HUD for you, but ask before you spend. HUD will come and ask for that penny. They do. I'm telling you, they ask for the last penny if you did it wrong. So ask before you spend so you get clarification, and then keep these things, our responses and your policies in writing. Update your policies. Just a reminder, if you did not add VAWA to your policy, if you did not add the emergency transfer plan to your policy, your audit compliance, it needs to be in your policy. And the emergency transfer plan does not mean you copy and paste. You need a plan to transfer someone that might be experiencing or fleeing domestic violence that you're serving. We need a real plan, so make sure you get that cleared out. I might be asking some of our DV agencies to give us guidance on that in the future, but that might be an office hours we hold in the next couple of months. It was great seeing everyone and talking to everyone. You will receive the PowerPoint. The recording will be on our website, and I hope to hear from y'all or see y'all in our next month's office hours. Don't forget to register for the conference if you plan on doing HOME-ARP. Some critical information will be provided. Thank you and have a blessed afternoon.
Ms. Tamara, this is Corey. Can I meet with you and Miss Sharonda for like a quick session?